And this is the third thing that most people that I help don't seem to know about COVID-19. They know that you're supposed to quarantine, they don't really understand why. And particularly, they don't realise that they're quarantined to protect their own household. You should quarantine away from everyone in your household, avoiding all human contact. That is to say, physical distancing, not social distancing. The WHO make a big difference between the two. So, why should you avoid contact? If you're in contact with someone who's got COVID-19, why should you isolate yourself? And the reason is, so again, many people don't quite understand this, so I've got to explain this. I think if you truly understand what is going on, then I think it helps people. So this may look a little bit tacky, but it isn't really. So first of all, if you look at flu, then with flu, it's 1 to 4 days. If you are in contact with someone who has flu, then in 1 to 4 days, usually 2 days, you develop symptoms. And it is not really, and you are infectious just the day before you have symptoms, mostly the day after that, and a little bit for the rest of the week. In that situation, then quarantine would really do very little to stop it. Very, very difficult to stop flu with quarantine. However, with SARS and MERS, it's a little bit longer than that, several days. With COVID-19, it's very long. That if you were contact at that point, at day zero, you're the contact, right? And so you were talking within 1 meter of someone for 15 minutes, and then you hear that they've got COVID-19. Then, and by the way, if you get COVID-19, tell your contacts. Our contact traces are way over stressed. They haven't got enough time to trace everyone. And the remarkable thing about COVID-19 is that you have to have very sustained, very close contact, normally talking back and forth, not silent, talking for 15 minutes or more with someone to count as a contact. This means that if you've got COVID-19, you almost certainly know all your contacts. Or at least if you went through all the ones that you can think of that you remember talking to, if you rang them all up and tell them, I've just been tested positive with COVID-19, and then and support them and help them and advise them what to do, then you've done your own contact tracing. Nobody really needs to ring you up. And people who have been in contact with you in the 1 to 2 days before you develop symptoms through to when you got tested. And if you tell them, then if they're sensible, then they would then do this quarantine. And so if the general public are very alert to this, you don't even need the contact tracers. And they could just tell each other. And so just suppose that I got COVID-19 and I just developed symptoms. And then there was someone I was talking to early today or yesterday, and I hadn't done the physical distancing. I had been lapsed in it, or I just didn't think about it, and I was within a meter, and I was talking to them, and I talked to them for 15 minutes. Then I should ring them up. And the chances are that they have not yet become infectious. That's the whole point. So, and they may be living in a house with 4 or 5 other people, but unlike flu, if I ring them up as soon as I get symptoms, they are likely not yet infectious. And so you get down to, it's getting on to 10, 12 days before, at that point 1 in 10 haven't yet developed symptoms. But about half of them haven't developed symptoms 4 or 5 days after the infection. So they've probably got 2 or 3 days yet. If I ring them up as soon as I get symptoms, then probably they've got 2 to 3 days before they even can infect anyone. So what is going on there is that the virus is in their body already. If I infected them, the virus is already in their body, but it's not detectable. It's in very, very small amounts. The human body cells are absolutely minute, and a few viruses reproducing in a few cells, you just can't detect it. There's no chance. just can't get enough material to have a good guarantee of finding the virus in it. And then with some people it grows very quickly, in some it grows very slowly. So that's basically what this why they quarantine. Because they've got the virus, they might have the virus in them. There's only 1 in 10 of the people I ring up would likely have the virus in them, or maybe even less than that. But none of them, there's no way of knowing which of them have the virus. And any of them, it's the 1 in 10 chance they've got the virus. And it can be less than that. So it's mainly with people who've got lots of contacts that you have a high risk that you pass it on to someone already. But anyone who's just got 1 contact, they may have the virus in their body already. So they actually won't be infectious. So this is the time until they develop symptoms. And the longest time scale, actually the 14 days, it's a rather notional cut-off. Most of them is already within 12 days. Within 10 days, the UK is cutting it off with 10 days now. And at that point, most people have already developed symptoms by then. This is only 1 in 10 haven't developed symptoms by then. And then 1 in 100 by 14 days. And then, but if you go down here, it could be 1 in 1,000, could do it by 21 days. And this is very hard to study because you've got the possibility of second infections, so being exposed to you, they weren't infected by you, exposed to someone else, and then they were infected by them. So, but there are some quite clear situations, like very early on in China, before it had moved to the other provinces, then there were some people who seemed to have been infected in Wuhan and didn't show symptoms until over 3 weeks later. And then in New Zealand, there's one man who went through the 14 days quarantine, and then he went home and visited his wife and child, and his wife and child were he developed symptoms 7 days after finishing quarantine, and then his wife and child got it. So in very rare cases, it's very hard to totally verify whether he could have been somehow infected after quarantine, some asymptomatic case or something, but it doesn't seem very likely, and probably it was, if any of you reading this happen to know what the final outcome was of this New Zealand man, the latest information I could find him was still researching. I haven't managed to find what the outcome was, but he's if this is confirmed, then it's 21 days. So it's and then there's these cases in the literature from China from early on. And yes, I did search, and I couldn't find any papers, I couldn't find the latest details. I know some of you are from New Zealand, perhaps you know whether they managed to find out any more information about it, or it still remains an enigma. But certainly in the literature they just don't know how long the incubation period is, but it's very rare to be that long. So that's why, yes, I'm talking a bit too much about this. So that's why you quarantine, is because you're preventing the people in your household. And it's, most of all, it's your household more than anything else. So when they talk about quarantine in a household bubble, but really you should be quarantined. If you look careful at the NHS website, they do say you should isolate away from the people in your household, and that actually is by far more important, because 80% of the transmission is in your household. So I was talking Mike Ryan's golden wish. Oh yes, I never got down to his golden wish, so let's find his golden wish. I'll read that out. Yeah, so I mean he says he doesn't believe that it's been done systematically anywhere in Europe, what I'm just describing. So countries are facing many dilemmas right now, but for me, if I get a chance for a golden wish to improve one thing that could really, really improve and change the game here, apart from all the other advice about massive physical distancing, I'm going to come to that with number 4, and asking people to stay the course. It's tough, but I was being asked if as a public health physician I was asked for one thing could improve by change the game here, and his answer is making sure that each and every contact of a confirmed case is in quarantine for the appropriate period of time, so as to break chains of transmission. And he does not believe that this occurs systematically anywhere, and particularly in countries that are experiencing large increases now. He means anywhere in Europe. It is being done, was done systematically in China. And so that's his one golden wish. And this would really turn it around if we did this. And sadly, our government is just not focusing on this. So there should be ads every day. You should not be able to get away from the information saying that if you want to protect your loved ones, then as soon as if you are a contact, then that's who you're protecting most of all. And the WHO say that 80% of the transmission is still in households to close contacts. So if the close contact gets infected, 80% of the transmission from them is to their own household. Only 20% is outside the household of the average case. So if you can stop the contacts within the household, and that's where tracing works especially well, because if you do the contact, if I rang up everyone that I saw in the last day or two, and I've just tested positive with COVID-19, and ring up everyone that has been in contact in the last day or two, which is nobody because I do careful physical distancing, but suppose I didn't, and anybody was an actual contact, then I would ring them up and say, you've got to, if you want to protect the rest of your household, then you would be very well advised to quarantine. And Mike Ryan, in this video, he says the same. He says that if he had COVID-19, then he would contact everyone who, I'm not sure if it's where it is in this video, he says that he would contact everyone who he was being in contact with him, and not bypass the contact tracers, but he would just tell them, because that's what contact tracers. And then did I explain I'm not sure I did explain. Okay, so all the COVID-19 is very, very unusual, and one of the unusual facets of it is that people generally know all their contacts. You don't get it from a random person you're walking past in the street. That is it doesn't seem to happen at all. There are no confirmed cases of that. And you don't get it very easily from surfaces. There are no confirmed cases of people just getting it from a surface. If they get it from a surface, it's usually in a context where they're also talking. So it's very hard to disentangle. I think it does happen that way, but only part of the larger picture. And so generally, if you get it from someone, you have been talking to them at closer than 1 meter for at least 15 minutes, or some other very close contact. And it's the droplets that pass from mouth to mouth, or mouth to nose and eyes, tiny droplets. And they only travel 1 meter, which is the reason for the 1 meter spacing before they fall to the ground. So if someone has, the ones that are big enough to infect, so if that's and because you need quite a large viral load, not just one virus to infect, you need quite a lot of virus, and that's why having it for 15 minutes and these big droplets, then that's what you've got to watch out for. It can also be, there was a case of a prisoner who gave it to the prison ward, in fact a whole group of prisoners with COVID-19, they gave it to the prison ward, only visited them for 1 minute at a time. So 1 minute of close contact frequently during the day of someone with COVID-19 is the same as 15 minutes. He had 17 minutes of close contact with 1 minute at a time, and he got it. So if someone is a contact, and if they immediately quarantine and they keep away, and so then you've got the advice on how to quarantine. So let's look at what you're supposed to do. But basically, it's as much distancing as you can. If you could, then actually, in fact, if you've got a separate building, but very few people have that. Some people do have, though, like a converted granny house in their garden for visitors, or your shed, maybe it's been converted so you can have visitors living there. If you have anything like that in your house, and if someone in your house is a contact, they should go there and isolate away. And same if they have to isolate. If anyone in your house isolates and you've got a shed for visitors, or you've got a separate building for visitors, they should isolate there, not have any contact with you at all, and just leave things at their door except when you've got to go in and care for them. So it's the same with quarantine as with isolating. But so this is where's my advice on how to quarantine? Not my advice. Here we are. So how should I quarantine? So you have a large, well-ventilated single room. If that's not possible, place beds at least 1 metre apart. And always keep 1 metre distance. This is the World Health Organization advice. And someone else gave the CDC saying that the beds should be turned around so they head to foot, so the heads are as far apart as possible. And look after your comfort and so on. Make your physical and mental health is very important, of course. And this is if you think you were exposed to someone with COVID-19, that's where I started. And I just explained what it all means. And even if you feel healthy, and then more detailed here, and then you should have a separate bathroom if possible, and caregivers as well. This is still about. No, that's about if you've got COVID-19. So that's what you should do if you're quarantining. So this is the one thing that, again, not many people know this. Of course, everyone has heard of quarantine. Not many people understand why you quarantine, and almost none of the people that contact me understand that the reason to quarantine is to protect the other people in your own household as the absolute top priority, because 80% of the transmission goes that way. And the understanding of that seems very rare in Europe, and the United States. It doesn't seem to be widely understood why you do quarantine. So that's number 3 of the things that the World Health Organization are very clear about, and that very few of the people I talk to even know about, have even heard of.